Zipalertinib is a new drug that we have as a TKI against EGFR exon 20 insertions. Right now, we just have Amivantamab plus chemotherapy in first line and Amivantamab in second line for these patients. And actually, it's an unmet need because it's very toxic. And we always say that Amivantamab has a manageable side effect profile, but it's quite toxic. So having the option of using a drug, an oral drug, it's something very interesting. It's a second line trial, actually. It's a second line. It's a trial that was not compared to anything. So it's just Zipalertinib for patients that had progression on platinum-based chemotherapy and or Amivantamab. And we got some very interesting story there. We got like 60% response rates. We got patients that were receiving the drug for maybe less than 10 months. So, and this for a pre-treated population, this is quite interesting. So I'm not here to discuss, well, there's no comparison here, so there's no hazard ratios, and we cannot draw conclusions to say which way is better. But I think this is a very good way of thinking that with a high response rate, a manageable side effect profile, I think it's much more manageable than we have, for instance, with Amivantamab. Rash, which is the most important thing, we have like 78% of patients with any monotherapy having it. Instead, we have 30% with Zipalertinib. Well, we have some other bad stuff like dry skin, diarrhea, and diarrhea maybe is the worst problem here, but it's manageable. When I do not like the word manageable because, well, it's manageable, but it's not with you, right? So, but manageable is just because it's much easier for you to just use an anti-diarrhea agent and have a good life with it. So I think it's going to be an option. We have trials in first line right now going on. We have the REZILIENT3, the Wukong 28, and the Fervent with Zipalertinib, Imuno-Oncology, and Zipalertinib, of course. And we are waiting on the results. I really do hope that this could be a very interesting first-line option for patients instead of just giving chemo plus Amivantamab to everyone.